introduce Annavaha srotas. We'll introduce digestion today, and let me get started. So, in today's class, we're going to do all of these. We're going to talk about the sense organs and what it does to your digestion, your appetite. We'll introduce Annavaha Shrotas, and we'll look at the sub doshas and what each sub dosha does as far as digestion goes. We'll introduce certain imbalances. So we're not going to look at treatment, and we're not going to do the protocols and the pathogenesis or anything, but we're just going to look at the symptoms and learn these names and learn about imbalances of the Annavaha Shrotas. And of course, we're going to see what happens to your doshas, the effect that Vata, Pitta, and Kapha have on the Annavaha Shrotas. So basically, Annavaha Shrotas, Anna means food, and Annavaha Shrotas is the channel that carries food. So you can compare it to your GIT, to the digestive system. So that's what we're going to learn about today. So the first and foremost, the thing is, the very thought of food, the smell of food, the sight of food makes you hungry, makes you crave for food. So Ayurveda just uses this particular intelligence that your body has, and that is how we and that concept is what we use to a person who has Vata, Pitta, or Kapha, and to how you have your food. So this is something that happens to all of us. When say for instance, you're on the class right now, and if I'm going to teach you something about ahara, and if I'm going to talk to you about different sorts of food, and I say, I'm going to add this to my food, and this is how it looks, and or if I'm going to talk to you about some sort of dessert, the very thought, listening to me talk about that food, is going to make you crave for that food, is going to make you hungry, and that will you're like, you start feeling hungry and you start craving for that food. Now if I'm going to put out pictures, and you're going to see food, and now you're going to think about food, so basically your body starts your body, the brain sends signals, and you start feeling hungry. You start salivating for food, there's secretion of enzymes, and now you're hungry and you're ready to eat. So this is the role that now this is the role that your the sense organs play as far as digestion goes. Now, what is an appetite? So we hear this very often, a good healthy appetite. People ask you questions about your appetite, and that's something that we have to ask our clients also. So what exactly is a good healthy appetite? So how I'd like to look at it is, I'd say a good appetite is when you're hungry at the right time for the right food. So we often go through these phases when you're hungry for sweets, or you're hungry for some heavy food, or you're kind of craving for for fries, or for something that's very unhealthy. That is not good appetite. Good appetite is when you're hungry for good food and at the right time. So Ayurveda uses this uses the fact that there are certain doshas that are predominant at certain hours of the day, at certain times, and your body's intelligence, when your body starts feeling hungry, when your body is craving for food. So Ayurveda uses that concept, and it the basic idea is, you eat when your body wants food, when you're hungry for food, and you don't eat when you're not hungry or when your body doesn't want food. So this is a very simple thing. Actually, there are people who use this. I've seen a few doctors who actually advise their patients and say, if you're not hungry, don't eat. But in Ayurveda, we don't do that. We kind of assess the Agni, and we make sure that the doshas elevate, and they're aggravated at the right time for the right food, not in terms of a disease or not in terms of an imbalance, but that's how the natural process is. So we advise people to have heavier food during noon, simply because there's more pitta at that point, and when there is more pitta, there is better agni, and your food gets digested faster, because all the enzymes that are secreted are pitta, and therefore your food gets digested faster. For the very same reason, you advise people not to eat very heavy food at night, because at night there is kapha, where the agni is less. The dosha doesn't really help in your digestion, so you advise people to have food that can be digested easily, and food that's lighter during the for dinner during night. So what happens with these, with doshas? If you're hungry but you exercise, or you exercise after your strength, after that threshold of your strength to exercise is over, but you still continue exercising, you over exercise, then what happens is your vata gets vitiated. Now if you over and again, when you exercise immediately after you eat food, your vata gets vitiated. Now if you overeat when you have very little appetite, when you're not at all hungry, but you're forced to eat food, and you forcefully feed yourself when you're not hungry, when you don't have an appetite, then you vitiate kapha dosha. And when you are very hungry, and you're a pitta person and you're very hungry, but you don't eat food, you kind of you're busy with work, or you're doing something else, and you decide you're not eating at that point, then you aggravate pitta dosha. So there's an increase in pitta dosha. So what exactly is the difference between a good appetite and a wrong appetite? Like I told you, how I like to look at it is, a good appetite is when you're hungry at the right time for the right food, and bad appetite is a wrong appetite is just the opposite of that. When you're craving for food as soon as you've eaten food, that means there's something wrong with your appetite. There are some people who are very hungry, who are so hungry, you go out to eat with them and they say, oh, I'm really hungry, I could eat anything. And once the food is served, they eat like a few spoons of food and they're full, they can't complete their food. There's something wrong with their appetite. The appetite is not normal. A normal appetite is when you're hungry and when you can eat a sufficient portion of food, again not filling your stomach but leaving enough space for air and water, then your appetite is good and it's fine. Now there are people who have no appetite at all throughout the day. They have a very very low appetite. They keep telling you that they're not hungry and they don't want to eat and they don't feel like eating. Then definitely there's something wrong with their appetite, there's something wrong with their agni. So when you're hungry and when you really have to eat food, instead of eating food that is healthy, that is nutritious, if you feed yourself with food that is either, like for instance, if you're really hungry and you decide that you're just going to eat chocolate cake or you're going to eat a pastry instead of eating food, then you're actually suppressing your appetite, eating something that's not going to give you the benefit that you should have. Or if you're very hungry and you decide that you're just going to have a mug of coffee instead, or you're just going to drink some water and try to wash down that appetite, then you're eating the wrong food and you're trying to suppress your appetite, and that can backfire, leading to different sorts of imbalances to this Annavaha srotas. Okay, so is this too much for you to take? Is this okay? Okay. So now what each dosha does to your digestion. The first is vata. So vata dosha plays an important role in sensory perception, in mastication of food. Now we'll look at the sub-doshas and we'll see what each sub-dosha does. But this is just in general what vata as a dosha does, how that dosha helps in your digestion. It stimulates saliva. So saliva is actually kapha dosha, but that stimulation, that process is done by vata dosha. So, and another thing that vata is air. So for your pitta, for the agni, so digestive fire to function and to, for fire to ignite, you need to have that vata, you need to have that air. So that is what vata does, and that is how vata helps digestion. Pitta is the most important dosha as far as digestion is concerned. So pitta basically helps in your HCl production, enzyme production, in all the metabolic processing that happens. Basically, your Agni functions, the Jhatar Agni, or the digestive fire, functions only when Pitta dosha is in proper quality and in proper quantity. And it also helps in your carbohydrate digestion. And kapha. So kapha is basically the mucus lining that is there. That is your kapha dosha, the fluid secretion, the bacterial colonization. All that is taken care of by kapha dosha. So this is basically how each dosha helps in the process of digestion. Okay, so now the sub doshas and digestion. So the first thing is, this whole process of digestion is aided not just by the dosha, but in each step, each process, you have sub doshas, the subcategories helping you perform a function that will help in this digestion. So I'm going to explain each of these doshas so it's easier for you to understand. Beginning with the mouth, you first have bodhaka kapha. So what this bodhaka kapha does is, it's present in the face, in the mouth, and this bodhaka kapha helps in taste perception, and it helps breaking down the sweet rasa, the starch, and the carbohydrate that you eat. The carbs, all that is broken down by this bodhaka kapha. Then you have the prana vata. So the prana vata is present in the head, the chest, and the throat, and this prana vata plays an important role that helps you swallow your food. So the act of swallowing food is done by this prana vata. So now food goes down to your throat, and there you have so there's another vata called udana vata, which is present in the nose, the chest, the umbilicus, and the throat. And this udana vata also helps in chewing and in mastication of food. So now whatever doshas, whatever sub-doshas are there on your presentation, these are the important sub-doshas. So if I mention one or two sub-doshas that are extra, just understand that those doshas also play a role in digestion, but these are the most important sub-doshas. So now once food enters, it goes down your it goes down and it reaches your amashaya or the stomach. And once it reaches the stomach, there you have kledaka kapha, which is your which is basically the mucosa lining that is present in the amashaya, in the stomach. And this kledaka kapha helps to moisten all the hard food that you eat. So once that is done, then you have the most important dosha that helps your digestion, which is the pachaka pitta. So this pachaka pitta is what helps to break down the food, and what helps to cook the food inside the stomach. Basically, your digestion is taken care of by the pachaka pitta. And then in the amashaya, in the stomach, you have the jhatar agni, which we've learnt about before. So that is the digestive fire that helps to cook food, and we've learnt about the jhatar agni. So the jhatar agni is also present in the stomach. Then you have another pitta, which is ranjaka pitta. So this ranjaka pitta, in one of the samhitas, the acharya says ranjaka pitta is present in the stomach, but there are certain other ayurvedic scholars who say that ranjaka pitta is present in the liver and the spleen. But anyway, the function of the ranjaka pitta is to convert the useful part that is taken from the food into blood. And basically the rasa to rakta, that conversion where all the useful part is taken and converted into rakta, that is done by this ranjaka pitta. So now after that, the food moves further and you go into the intestines. So there you have samana vata. The samana vata is very close to the fire, to the Agni, to the digestive fire. And the main function of the Samana Vata is it moves in the koshta. So it will receive the food, it will help in digestion, and it will help to divide the food into the nutritious portion and the waste product. So the waste portion will then be eliminated, and the nutritious portion will undergo further processing. And then you have the Apanavata. The Apanavata is also present in the intestine, and this Apanavata is what will finally help move. So that Apanavata's function is basically to help everything move in the downward direction. So everything from your feces to the gas that is present in the stomach to your menstrual fluid, everything gets pushed in that lower direction by Apanavata. Then in the liver, you also have the Bhuta Agnis, which are the Agni that helps to digest all the elements, the 5 Mahabhutas. So that Agni is also present in the liver. So basically, this kind of sums up the entire the subdoshas and your digestion. So this is what happens in your Annavaha Shrotas. These are the important subdoshas. Each subdosha has a particular function, and this is Ayurvedic digestion for you. Is this clear? Is this easy to understand? Do you have any doubts in this? I know the names are going to be a little difficult for you to just understand, but is this clear? If you go through this once more, I think it'll be easier. You'll slowly start. Yes, exactly. So you just need to go through it once more. But other functions of each of these subdoshas clear? If you have any doubts, you can ask me. Can I? Yeah, I know the names are difficult. See, the thing is, even when we do this for 5.5 years over here, so 5.5 years we learn Ayurveda, and the first year when you learn all these subdoshas, it's very confusing. It will take some time, a lot of reading, a lot of understanding for you to remember the names and remember what exactly the function is. But as long as you can understand the entire gist of it, it'll all just come to you. Trust me. So can I move on to the next thing? You don't have any doubts in this, right? Okay. So now, what is the Annavaha Shrotas? So Annavahanam Shrotasam Amashayo Moolam Vama Cha Parshvam, which just means Annavaha Shrotas is the primary organs of this Annavaha Shrotas is the Amashaya, which is the stomach, and the Vama Parshva. Vama means left, and Parshva is just the left lateral side of the body. That is called Vama Parshva. So Annavaha Shrotas is the channel which carries your Anna or food. Now the causes for vitiation of the Annavaha Shrotas. Atimatrasya cha, akale cha, ahitasya cha bhojanat. Don't get worried looking at all the Sanskrit and all the shlokas and all that. It's very easy. These shlokas were it was just an easier way of by hearting the entire Ayurvedic text in the ancient times. So in the ancient times, so don't worry about the Ayurvedic, the Sanskrit words and all of that. It just simply means that the Annavaha Shrotas gets vitiated when Atimatrasya. So Atimatram, sorry. I'm so sorry. Yeah. So Atimatram means eating excess food. Ati means excess and matra is quantity. So if you eat more quantity, excess quantity of food, akalecha. Akala means kala is time and akala is improper time, so or incorrect times. So if instead of eating your breakfast in the morning, if you eat your first meal, say somewhere around afternoon or a little later, then that is akala. That is an improper time to have your breakfast. If you eat in between meals, if you eat and immediately go to sleep, so basically eating at all the improper, incorrect times, that is akala. Ahita. Hita is something that's beneficial to you. Ahita is, so basically when you add a in front of a word in Sanskrit, it just means the opposite. So ahita means something that doesn't benefit you, something that harms you, something that's unwholesome for you, like eating junk food, eating two things that don't go together, like drinking milk and then having something that's citrus, or having something that doesn't go with it. That is called ahita, food that doesn't that is unwholesome to you. So that will vitiate the Annavaha Shrotas. Annavahini Dushyanti. Dushyanti means vitiating. Vaigunyat Pavakasya cha. So Pavaka is the fire that's there. It's another word for Agni. Vaigunyat is when the Agni is disturbed. When it's either too much or too less, or when it fluctuates, then that will cause diseases of the Annavaha Shrotas, because that will cause an imbalance in the Annavaha Shrotas. If you guys have any doubts when please do stop me and ask me your doubts. So some of the very commonly seen imbalances of the Annavaha Shrotas. First one is Admana. Admana is when there's bloating sensation in the stomach. There's distension of the abdomen, and you feel very uncomfortable. That is Admana. Shula is any sort of pain in the abdomen is called Shula. Shula is basically, it just means pain. In Ayurveda, Shula is a word that's very specific to the abdomen. Pain in the abdomen is Shula. Anna Vidvesha. Anna means food, and Vidvesha means dislike or hatred towards food. So you basically have no appetite, and you don't feel like eating food. There's an aversion towards food. This can mean, for sometimes it just means that even the very thought of food, the very sight of food makes you irritated, or makes you want to throw up. That is Anna Vidvesha. Chardi. Chardi means vomiting. Pipasa. Pipasa is thirst. Ajirna. Ajirna means when there's indigestion, when either there is vomiting and diarrhea, or there's either one of it, but you start throwing up, or you bring out food that is not digested at all. That's you kind of bring out exactly what you ate. That happens in case of ajirna. Vibandha is constipation. Bandha means bandha means constipation. Bandha means something that's very tight, that's very hard. Amla pitta is acid reflux. It's just basically acidity. That is amla pitta. And atisara is diarrhea. So we're going to learn a few diseases today, but these are just the literal translations of certain imbalances that are seen in the Annavaha Shrotas. So now, distension of the abdomen and bloating. So there are 4 types of bloating. Now the important thing is, all these types of bloating is associated with Vata dosha. When there's bloating, when there is distension of the abdomen, there is a Vata prakopa. There is some sort of a Vata disturbance in the stomach. So Anaha is when there's distension of abdomen while passing stools. So there is that urge to pass stools, and while a person is at it, there's distension of the abdomen, and there's a lot of discomfort, and there's enlargement of the abdomen. That's what it means. Then Admana. Admana is distension with gas. So there's a lot of flatulence. That is Admana. And like I told you, in all of these types of bloating, there's a lot of discomfort. There is some sort of a pain, some sort of a you're just basically, you want to get rid of this accumulated vata, and you just want to get rid of it somehow, and it's very irritating and uncomfortable. Next is atopa. So whenever there is noise, when there is some sort of a gurgling sound in the abdomen, and there is bloating and distension of abdomen, then that's called atopa. The last one is udavarta. So udavarta is distension that's caused due to suppression of vegas, like your urge, natural urges. Vegas are natural urges like passing your stools, your appetite, urine, and so on. And Udavarta is, again, there's a lot of belching in Udavarta. There's belching and flatulence in case of Udavarta. So how you can help when there is some sort of a distension or bloating is by dosha pacifying diet. You have to make sure that you bring down that discomfort and all the gas and all the problems that are associated with this bloating. You can use spices like cumin, coriander, fennel, ginger, garlic, black pepper, and so on. You can advise buttermilk or some sort of a probiotic that can be given after a meal. You can use Triphala churnam, and or you can make a kashayam using any of the spices that are mentioned over here. You can just add your own spice to it, and then you just make a kashayam, and you can strain that and give that kashayam in case of bloating. Whenever there is a vata in the abdomen, when there is discomfort, there's pain, and there's gurgling sound, cumin is one of the most effective spices to use. So you can fry this cumin, add it to some water, boil that water, and you can use it. Or you can just add cumin to water, boil it, and use it. Or you can even use powdered cumin. It's up to you. But cumin in some form will help bring down this accumulated vata in the abdomen. So next is ajirna. So ahara is not digested properly because of vitiation of Agni. That is what happens in ajirna. There's indigestion. So certain causative factors of ajirna is excess fasting, overeating, irregular intake of food, eating when you're not hungry, or eating when eating at very odd hours, not eating on time, eating food that is incorrect, that is unwholesome for you, eating very dry food, very cold food, eating food that is spoiled, suppressing your natural urges, emotional factors, when you're angry, when you're jealous, when you're upset, when you're anxious, all that can lead to ajirnam. And then improper use of the panchakarma therapies, that can lead to ajirnam. In certain cases, even as soon as you eat your food, if you apply oil and have a bath, or you immediately have a bath, that can cause ajirnam. Eating two different kinds of food that don't go together well, that can cause ajirnam. So common symptoms of ajirnam is there's abdominal distension. It is often associated with vomiting or with diarrhea. There's a lot of tiredness, there's thirst, there's anorexia, and so on. Next disease, the next imbalance is atisara. So atisara, like I told you, ati means excessive, and sara is some sort of a movement or some sort of flow is called sara. It is sarana means some sort of a movement or flow. So in atisara, there's excessive bowel movement. So you basically eat food, and normally what happens is the during the process of digestion, all the water is absorbed, all the nutrients are absorbed, and there's a whole process that happens. In case of atisara, what happens is the apana vata is imbalanced, and therefore even this absorption of water doesn't happen as it should. So this water gets mixed with the food, with food that is either not digested, or just food that has to be absorbed doesn't get absorbed, and it just comes out along with the vitiated apana vata, and there's excessive there's excess bowel movement, and that is called atisara. Now it can be of different types based on the dosha that is involved, based on what type of pathogenesis happens, but we don't need to learn about it in that much detail. You just need to know what Atisara is, and you need to know that there is a vitiation of Annavaha when Atisara happens. So Atisara is just basically your diarrhea. Now the next thing is Vibandha. So all these conditions that we're going to talk about today are conditions that are very, very, very commonly seen. You'll see a lot of people who will have complaints, with these conditions that we've seen. So you just need to know what it is and have a basic idea about what you can possibly do in case you come across somebody who has a problem that that we're talking about. um, Even yourself, we as Ayurvedic physicians, we master whatever we do by practicing a lot of stuff on ourselves, because these are certain things that each of us would have faced at some point in time in our lives. So Vibandha is constipation. It is a condition when bowel movements are occur less often than usual, and you have hard, dry stools that are very painful and difficult to pass out. So this is a very commonly seen condition, and it can either be a problem on its own, or it can be a problem that is caused because of some other disease, or it can be a side effect of certain medicines, or like antihistamines or antipsychotic drugs, or aspirin, beta blockers, or certain other medications that is had. Symptoms of Vibandha is abdominal discomfort, bloating sensation. You have that urge of flatulence to pass gas, abdominal pain, low backache. Sometimes there might be symptoms like headache because of that that discomfort, that not being able to pass your stools, and the fact that these dry stools make it very painful. So that can lead to headache, and that can lead to nausea and so on, painful defecation. And if you strain a lot and with a lot of pressure, there can be anorectal bleeding, which can also be one of the symptoms that is seen. So in case of Vibandha, what happens is there is a vitiation of Apanavata as well as Samanavata. So causes of this can be not drinking enough water, or lack of fiber content in your diet, lack of proper exercise, intake of food that is very, very dry or very rough food, basically not using enough ghee or enough enough oil in the preparation of your food. That can cause Vibandha. And when food stays in longer in the GIT, more water gets absorbed, and that can result in dry, hard stools, and that can cause constipation. So the first thing in case of constipation is to understand the cause of this constipation and then treat it. Like if it is because of a side effect of some medication, then you have to wait till the course of that medication is over, or if you can discontinue the medication, then you do. But you have to talk to your general physician who prescribed that medicine. As an Ayurvedic physician, as an Ayurvedic practitioner, you cannot you cannot taper or increase or decrease or stop any medication. The other next thing that you have to do is to see whether it is a side effect of some other disease, and then protocol has to be taken accordingly. Or if it is because of Agni, then that has to be assessed and that has to be balanced. If there is some sort of a blockage, if there is some sort of an occlusion that happens with Vata, then that can also cause Vibandha. So if that is the case, then you have to clear that blockage, you have to clear that occlusion that has happened. So there are certain panchakarma therapies that can be done, or you can just increase the fiber content in the food. So you give more beans, whole grains, pulses, food, things like oranges and so on. So basically you bring about a change in the diet. And then intake of warm water, sipping warm water, that can be done, and proper exercise can be done. Vibandha is a condition that's very commonly seen in very small children, little kids who have this problem, and it's best not to give medicines to help reverse this constipation in case of small kids. So the best thing to do is you can soak 10 to 15 raisins in water, and the next day you can ask them to consume that. That will help, that will help solve this particular thing. Let me just write that for you. Soak raisins in water. So this is something that works very well for very small kids and even for adults, but in case of kids, you don't want to give them medicines that are not needed. So this is something that you can try. Now moving on to the next. So the next imbalance that is seen is a condition called grahani. So grahani is basically an organ that is explained in Ayurvedic anatomy. It can be compared to your duodenum. So grahani is basically the seat of Agni. So it is this grahani that holds the undigested food, and it is the seat of Agni. So it is what helps govern the function of Agni. So if there is a vitiation in this grahani, then your Agni is impaired. There's an imbalance in the Agni, and that can lead to various disease conditions. So all these are, you again, I'm not going to go into detail. I'm not going to talk about the pathogenesis or anything, but in short, this grahani it can be compared with your IBS, irritable bowel syndrome. You see symptoms that are very similar to IBS. So some of the symptoms that are seen is you have chronic indigestion, that bowel movements vary. It can either be very loose stools with increased frequency, or you will have very hard stools with decreased frequency. So you'll basically have diarrhea as well as constipation, and that will just keep fluctuating. So the person might have this urgency to pass stools, to defecate, but they cannot pass stools, or even if they do, it's very small quantities, and you keep having that feeling. You keep having that feeling that you want to defecate but you cannot. The feces may contain some amount of mucus. There'll be distension of abdomen. There will be pain in the lower abdomen, the groin, the flanks, and there'll be a pricking type of pain which is called vishuchika. So vishuchika is basically a type of pain, like it is explained as suchivat iva vedana, wherein like how you take a needle and you keep poking or pricking somebody, you have that pain, right? If you keep pricking your finger with a needle, with a very sharp pointed needle, the kind of pain that you feel on your skin, that kind of pain is felt all over the abdomen in this condition called vishuchika. And this symptom can be seen in certain cases of grahani, where a very cramping type of abdominal pain is seen. So a very chronic condition of this can lead to fatigue, malnutrition, and other related disorders. So there are different another thing is, if a person has atisara, a person has diarrhea, and they ignore it and don't treat it, and if nothing is done, then that can lead to grahani. So grahani can be a complication that comes when atisara or diarrhea is not treated. again, because grahani is so basically graha is a term that means you can hold, or you catch hold of something, that is called graha. And the name grahani was given because of the power that this particular organ has to restrain the downward movement of food. So it holds on to food, it basically catches this food and holds on to it and ensures that agni digests food. So that is the function of grahani. So when there is an impairment of agni, and when there is an imbalance that happens in this particular organ, then what happens is food is not digested, it just passes down. Does that make sense? So then you have diarrhea, you have indigestion, you have constipation, and so on. When that very function onto the food and making sure that agni digests that, when that doesn't happen. Okay, so now moving on, certain common hetus of this particular grahani: improper food habits, like not eating enough food, or eating food before the previous food is digested, or overeating food, eating food that doesn't that's not compatible, eating two different types of food, like eating milk, drinking milk and then having either fish, or having something that's like citrus, having lime, or something that don't go together, or having two very opposite kinds of food together, like having a combination of something that's very hot and very cold together. That can lead to grahani. Excessive consumption of very heavy food, very cold food, very dry food, emotional factors like worry, depression, anxiety, that can lead to grahani. And again, when your agni is not good, when there's weakness of agni, when there is a fluctuation in the agni, either when there is excess agni or very little agni, then that can cause grahani. So these are certain common causative factors of grahani. So with that, I come to an end of today's class. Do you have any doubts in today's class? We've just basically introduced you um, to the whole concept of Annavaha srotas and all the disorders of Annavaha srotas. You guys go through this one particular thing just to see whether you understand you understand all the subdoshas and the functions of these subdoshas. If you have any doubts, do let me know. And if you need any clarifications, if you need something to be explained again, please do let me know. Thank you so much. Bye bye.
All right, there's an actual couple of minutes break, and then I have a little presentation. Thank you, Priyanka ji. It was actually very well done and easily explained. So a couple of minutes break, and then I have a presentation.